This session's on factors that influence the access to health. Nursing 3805, Session 6A. Have you ever thought about what factors really contribute to health? As nurses, we would assume, although we know that as nurses we aren't supposed to assume, but if we should, it would be that everyone would like to have good health. So whatever those factors are, they would be able to overcome them and obtain them. So let's look at what the World Health Organization describes as factors that contribute to one's health. The global context affects how societies prosper through its impact on international relations and domestic norms and policies. These in turn shape the way society, both at national and local levels, organize its affairs, giving rise to form of social position and hierarchy, whereby populations are organized according to income, one's education, occupation, gender, race, ethnicity, as well as other factors. Where people are in the social hierarchy affects conditions in which they grow, learn, live, work, and age. Their vulnerability to health and the consequences of ill health is always a factor. So some influencing factors that contribute to health are our social factors, ethnicity, our economic level, our political, educational, and occupation. And not necessarily our political level, but the political environment in the country. Social, we have health inequities are unavoidable in health between groups of people within countries and between countries according to the World Health. These inequities arise from inequalities within and between societies. Social and economic conditions and their effects on people's lives determine their risk of illness and the action taken to prevent them becoming ill or treat illness when it does occur. So if you could just look around the world, you can see the inequities throughout this country as well as throughout the world. Some social cultural factors or determinants of health are the circumstances in which people are born, grow up, live, work, and age, and the systems that are put in place to deal with illness. These circumstances are in turn shaped by a wider set of forces, such as economics, social policies, as well as politics. Economically, the benefits of the economic growth that has taken place over the last 25 years are unequally distributed. I want you to mull over that for a minute. In the 80s, the richest countries that contained 10% of the world's population had a gross national income 60 times that of the poorest countries that contained 10% of the world's population. Think about that. And by 2005, they state that this ratio had increased to 122. There's lack of health insurance is the most frequently cited barrier to accessing health care. Across the decade of the 90s, the number of uninsured in the United States climbed steadily up to an estimated 44 million persons in 2000. And across the decade in the 90s, Florida had a higher percentage of uninsured than the nation. Latest estimates hint that Florida is now closer to our national average. According to a survey that was conducted in 1999 for the Agency of Healthcare Administration by the local health council, 16% of Florida's adult population is uninsured. It's now down from 20% from 18% in 1992. Low-income persons lack access to health care because they do not have access to health insurance and cannot afford to pay health care services. According to a report that was issued by Kaiser Commission on Medicaid and the Uninsured in 2011, low-income Americans, that is those who earn less than 200% of the federal poverty level, that runs between $26,000 or so for a family of 3 and 99, run the highest risk of being uninsured. Nearly 40% of the poor, that is those with an income under 100% of the federal poverty level, and 30% of the near poor, those between 100 to 200% of the federal poverty level, lack health insurance. So like their counterpart in the rest of the nation, low-income Floridians lack access to health care because they are more likely to be uninsured, according to the Department of Health. Low-income and minority residents of Florida are twice as likely to be uninsured. According to the Florida Health Insurance study completed by the Aging for Healthcare Administration in 1999, Approximately 40% of the families earning between $5,000 and $10,000 per year are uninsured, compared to the about 13% of families earning between $35,000 and $45,000 per year. As the income goes up, you see, the percent of families without insurance goes down. Only 52% of those leaving welfare under the wage program that began in 96 were estimated to have health coverage in 1999, according to the Florida Health Study Program.